Moral injury in healthcare is high. We've been severely under-resourced for a very long time. Historically, nurses and healthcare workers have been viewed as martyrs, right? We are supposed to give and give and give. And even if we're short resource, even if we don't have what we need, we're doing it for the patient, right? So we aren't allowed by our hospitals or by our organizations to speak up and say, hey, this is subpar quality of care and we're burning out and we need help. We haven't been able to say that because there's a lot of retaliation in healthcare. Nurses and doctors speaking up and saying, hey, this is not safe is not really allowed, because then that falls back on the hospital or the leadership.
You mentioned the word martyr, which is super interesting. Is there a point where it switches to apathy and you just stop caring so much?
I've talked about this before, but it's a really hard subject. When nurses go into burnout, one of the end stages and most dangerous forms of burnout is when you reach that apathetic stage. And I would say that I was definitely in that stage before I left bedside. And it's not that we are giving subpar care. It's not that we don't care about the patient. It's that really hard, difficult, emotional things are happening to us on a daily basis and you can't feel anything. There is culture within healthcare that the better you get at becoming a healthcare worker, the less you should feel. And I was actually told by a lot of my superiors, once you've been doing this for a few years, this isn't going to affect you so much. Like, you'll have a handle on your emotions, right? And I think often we mistake having a handle on our emotions for apathy and not feeling any emotions at all. The way that affects you even outside of the hospital can be dangerous, not only for the patient, but for the nurse and their mental health.